Hey there, good afternoon, and welcome to Coping with COVID. Updates about the pandemic and information to help you thrive and survive COVID-19. I'm Tre Tailor, and Prisma Health has been on the front lines of not only treating patients, but also testing and research. And today, we've got two great gentlemen with us from Prisma Health. Vince Ford is a Senior VP of Community Health Services, and also we're trying to get connected with Dr. Jim Ellis. He's president of Prisma Health Medical Group here in the Midlands. Hey, Vince, thank you so much for joining us this afternoon. I appreciate it.
Thank you, Trey. Good to see you and good to talk with you and good to be on the show.
Absolutely. Thank you. Same here. How are you and your family, safe and well?
We're safe and sound. Thanks for asking. Even my extended family. And what about your family? Thank you for asking.
We're good. We're good. I've got family all over and everybody's good. Thank the Lord for that, But we're hopeful and we're prayerful that everything will be fine. I mean, this is above my pay grade. I'm leaving it in the hands of you folks like you and the Lord.
But no doubt. I mean, this is a time where you have to lean on your faith and lean on God. And that's what we've been doing and going to continue to do. And I'm encouraged that we're starting to see the light at the end of the tunnel. That's at least my belief.
Yeah. Absolutely. We're going to see if we've got Dr. Jim Ellis is joining us. Dr. Ellis, can you hear us? Oh, I think he's frozen again. Dr. Ellis, can you hear us? Yeah. Well, when we're able to get Dr. Ellis on, I definitely want to talk about some of these new symptoms. I want to also talk about this new mutant virus. But since you're here, Vince, and I know that you have, throughout your career, really been an advocate for our community, let's talk about some of these additional testing sites that Prisma Health is setting up.
So I want to start by thanking the leadership of Prisma Health under the leadership of our CEO, Mr. O'Callaghan, and then Dr. Sasser and Dr. Shelton, who've been leading our effort here in Columbia and in the Greenville area. They have helped to stand up a number of community responses, from working with our homeless shelters to provide opportunities for testing throughout the community, as well as work with other community neighborhoods association. Just yesterday, in fact, we had Dr. Shelton on a call with our superintendents who wanted to ask questions about potential graduation ceremonies in June, and they were able to answer a lot of their questions. So the staff here has been working around the clock, trying to be a good community partner in all of these areas. So great teamwork, great leadership, great effort.
Yeah, I love that you are taking care of the homeless population, because between the homeless population and the prison population, I think those are two demographics of people, along with the elderly, to be quite frank with you, that kind of fall by the wayside. And, we've got to take care of everyone, because if everyone isn't taken care of, everyone will be even more affected.
So you're exactly right. And Dr. Shelton has been leading, and Sasser have been leading us on a daily effort on all three of those demographics, from our senior citizens who are in senior homes to the prison population. He shared information with us this morning on our daily call. And we've been working with the homeless shelters, with United Way and other entities, the city of Columbia, the county of Richland, to work with those populations to keep them safe and sound as well, and to keep them from necessarily just wandering around, particularly if they have a fever or if they are positive. So we have instituted a plan to work with that population as well.
So Vince, tell me about some of these additional testing sites. Now, we know that MUSC and DHEC and, some other folks have been doing some testing throughout the community. What testing sites are available right now that Prisma Health has set up?
So that's a very good question, Trey. And Prisma has been extremely responsive in the upstate and in the Midlands. In fact, as we speak today, Prisma has a testing site at Hopkins Park, which is in Hopkins, South Carolina. That's from 9 until 3. This past Saturday, we were in Rembert, South Carolina, responding to the Sumter community. And then Friday, we'll be at McCord's Ferry in Eastover, South Carolina. The rural areas tend to get, at least the belief is, they get left behind, and services not provided. So I thank our leadership for including Eastover, South Carolina.
Absolutely.
And then on Saturday, May 9th, we're going to be at Lower Richland High School doing the drive-through testing and walk-up testing as well.
Okay, so Saturday at LR is this from 10 a.m. until 3 p.m.?
At 3, yes.
10 to 3. Now, this is for anybody. You don't necessarily have to live in that community. Is that correct?
That's correct. I mean, so Lower Richland High School appears to be a great site for people to drive in and out of without backing up traffic on 378. And a person can come up. They don't have to be from that community. They don't have to have any symptoms. And they can be tested right there in the parking lot.
Now, what type of testing is being done? Is this the swab up the nose?
That's the test that will be administered. I'm not sure if the other test will be administered, but definitely the swab up the nose.
Okay. All right. And how long is it going to take for these folks to get their test results back?
So, Trey, in some cases, and I'm going to give you a general response so that we don't mislead the public, but some cases, hours to days, it just depends on use, but it'll be pretty rapid. So there'll be a pretty rapid response. And what we say to people is that even in the midst of your testing result, you still need to continue to isolate yourself until you know what your results are, and continue to practice all the things that we know are best practices like social distancing, continuing to wash your hands, those kind of things, and not being in big crowds. And wear your mask. Yeah, wear your mask if you go outside, obviously. So yeah, those things are really important. But you know, Prisma is in the middle of responding to this community. We have our CEO has worked with the Richland delegation. He's worked with the mayor's office, with county council, with United Way, and all the community-based organizations. And a number of us have serving on committees that are working with the homeless, with the prison population, and our senior citizen population as well. So strategic partners with the schools. I mentioned earlier that we want to call yesterday with all of the superintendents in this area to ask questions about things that are going on in their respective communities. So we're just trying to be a good community citizen, and I think that is going to help move our community in the right direction.
Great. I want to come back to the conversation you had with the schools in a minute, but first I want to ask, what do people need to bring to these testing sites, Vince?
Just a driver's license.
Okay. Mm-hmm. Or a state-issued ID if they don't have a driver's license?
You're right. A state-issued ID. Yeah, exactly.
Okay. And then they'll get their results mailed back to them?
That information will go back to them either by mail or by phone, but they will get that information communicated back to them as soon as possible.
Now, beyond the testing Saturday at LR, are there any other testing sites or testing dates that we can be made aware of?
That's a great question, Trey. And Dr. Shelton and Sasser are in the process of developing other dates. We have received calls from other parts of the community asking for Prisma Health to come to those respective communities. I have been challenged with trying to identify some of the high-risk areas. All areas are at risk, but some of the high-risk where we can get some testing going on. So those dates will be put out to the public real soon.
Yeah. Vince Ford.
Locations.
Okay, Vince Ford is joining us, Senior VP of Community Health Services at Prisma Health. He's been telling us about the testing sites in and around the South Carolina area. And Vince, you just mentioned that you were on a call yesterday with some of our local school superintendents. What are some of their concerns, if you can divulge that information, and how is Prisma Health going to help them?
Yeah, absolutely. So we helped yesterday by having Dr. Shelton, Dr. Nash, and Shanetta Williams talk to all the Midlands local superintendents. They are saying to us that they are right now confronted with probably the toughest decision of the year, if not their career, and that is, do they have an in-person graduation?
Right.
Students are calling for an in-person graduation, and our goal on yesterday was to provide the expertise, the talent to answer any questions they might have. And for instance, questions like, should students wear masks if they come across the stage?
Right.
How many guests should they have? How do we practice social distancing? Should we check temperatures of everyone coming in and out? Do we monitor the restrooms or close them? Those type of questions came up because they're trying to decide if they're going to have a virtual graduation or in-person graduation. The students are asking for in-person graduation. Of
course, yeah.
And so they're trying to make a decision on what they think is the best route carry that out.
Yeah, I'm going to talk with Baron Davis of Richland School District 2 Friday, as a matter of fact, and JR, yeah, over at Fairfield. So,
Right.
to kind of figure out what they're going to do, because I'm sure it's a difficult decision to make. I mean, you want to celebrate the kids. They want to be celebrated. They deserve to be celebrated, but you've got to do what's in the best interest of everyone,
Nope.
and that's not always a popular decision.
Well, no question about it. And what our doctors shared with them and our staff shared with them is safety is number one. And then everything else comes after that. And so if you decide to do it in person, here's some things that you should consider. If you decide to, do that in person, here's some things that you should not do. And so we gave them the shoulds and the should nots based on our expertise recommendations. So
Yeah.
Well, on the line, and he asked some really good questions. One of the questions that came up is, for instance, they're going to check the temperature of people entering and exiting the stadium because they want to do these outside, not inside.
Right.
And so what happens if it's hot and your temperature is elevated
Because it's hot? Wow, that's a great question.
Yeah, so they were able to answer those questions. So it was good.
Well, I'd love to know the answer to that, because here's the question, because I don't know the answer, because I'm not a doctor. I don't know if you know this, but how can you tell if your temperature is elevated just because it's hot outside? Is there a way to tell that?
Well, what was shared yesterday was, and actually today again, was that if it is hot, it could be elevated because of the conditions. But if you've got the right
type of thermometer,
yeah, and do it under the right circumstances, then you're going to get close to a true reading, close to it. So, but one of the participants yesterday said that he had gone to the dentist and they checked his temperature outside, and it was a little bit elevated compared to when he got inside and he checked it, and it had come back down. So now because they're thinking about doing these outside, obviously that's a little bit of a difference, but they need to be prepared for that is the question.
Yes. That's a great question. That is a great question. And, because things are going to come up, and if you're dealing with that many people, you want to make sure as best you can, you make the right decision, because if something goes wrong, there's going to be a problem.
And one of the things I'll tell you this, Trey, it was good that the superintendents decided to reach out to Prisma Health, and Prisma's team responded immediately and we had a Zoom call with them on yesterday, and they were able to answer all of their questions. So we had superintendent from Richland 1 and Richland 2, from Sumter, from Saluda, from even Marlborough County on the call, yesterday, as well as a couple of principals and other staff members. And they asked a lot of good questions and got a lot of good responses. So.
Yeah, that's great. Vince Ford is joining us. He's Senior VP with Community Health Services at Prisma Health. Melanie Baker is watching. I want to say hi to her. Thank you, Melanie, so much for watching Coping with COVID. So, Vince, if people want more information, and before we go to that, can people outside of the community health drive-through locations, can they come to the hospital to get tested? Are there any stationary places that people can come get tested?
So, Trey, our recommendation is that people not come to the hospital, unless they have a need to, go through the emergency room for some life or health safety issue. But that said, if they live outside or not in Columbia, they can certainly go on our website and start the process on their website. They can also call their physician, or they can show up at one of these testing sites that we mentioned. Would be our recommendation.
Right. Now, if people do want more information about kind of updating on the testing sites or anything like that, how can they contact you or contact someone at Prisma Health to get updates?
So that's a great question. And you can, the best way to contact my email address is vince.ford@prismahealth.org. And feel free to email me. If you know a person's name at Prisma, you can put a dot between their first and last name at prismahealth.org, and either we can provide the answer for them or to them, or get them to the right place. So that is happening. For instance, I'll get a question from someone and I'll send it to Dr. Shelton and Dr. Sasser, and as busy as they are responding literally in minutes to
That's great.
questions that we get. So yeah, it is best to be informed and to have real information based on the science and based on our expert recommendations. So we would encourage people to do that.
So again, can you mention those 3 upcoming testing sites you said today in Hopkins?
Yes, so Prisma Health is at Hopkins Park as we speak. That's 144 Hopkins Park Road, Hopkins, South Carolina. On Friday, they're going to be at McCord's Ferry Road, 2750 McCord's Ferry Road, and that's the Richland County Recreation Center. That's in Eastover, South Carolina. And I'm happy about that because Eastover is the furthest point, one of the furthest point from downtown Columbia in Richland County. So to go out there, I think is a big deal. And then on Saturday, May 9th, we're going to be at Lower Richland High School from 9 until 3 doing testing as well.
And again, anyone is open and welcome to come to these testing sites. You just need to have some kind of state issued ID, your driver's license, your ID card, and they will be able to test you and get your information and get you your results back. Now, what about in other parts of South Carolina? You just mentioned kind of Midlands area, Columbia area. Are there any other testing sites across the state?
Yeah, you're exactly right, Trey. Thanks for asking. So the upstate also has testing going on. They had a testing site this past Saturday in Greenville, and then 2 additional days. They're testing today actually at a Baptist church in Greenville, and then on Saturday they'll be at the La Unica Super Center on White Horse Road. But that's Prisma Health. But there are also other parts of the state where testing is going on as well. So Prisma Health is testing in the upstate, here in the Midlands, and we're going to expand that by providing additional sites, more information to come. I'm sure Tammy Epps and our team will put that information out. But other organizations are also doing testing. And so wherever you live in South Carolina, you're likely to be able to get to one of these testing sites, hopefully fairly easily.
Yeah. Vince Ford, Senior VP of Community Health Services with Prisma Health, joins us. Tanya Haddon is on the watching. She wanted to know about any new symptoms. Well, I'm not sure if you can answer that, Vince. Dr. Ellis was supposed to be on, Tanya, but we're having some technical difficulties with Dr. Ellis. We were going to talk about the COVID toes, the bruising on the toes. Vince, he and I talked about this before we came on the air, and some of the rashes. Do you know anything about that? I just want to kind of...
Let me stay out of that lane.
Yeah.
And our clinical staff, those are good questions. And hopefully join back in, and we can, if you have questions, Trey, if he's not back on, just send us the questions and then we'll send you back the response.
That would be great.
And you can put it back on the air at some point. Yeah,
great. Thank you. Yeah, Tanya, thank you so much for watching. Like I said, Dr. Jim Ellis was on with us earlier, and we just couldn't get the connection to stick. So thank you so much for that question. And I will get back in touch with Dr. Ellis and Tanya Haddon. I will let you know. So Vince Ford, vince.ford at prismahealth.org. If you have any more questions or that you need answered, more updates on the testing sites, again, they're all across South Carolina, particularly here in the Midlands and Hopkins and at McCord's Ferry, and then at LR, Lower Richland High School on Saturday, Friday, and then in the upstate, several areas in the upstate throughout this week. And more information will be released as it becomes available. Correct, Vince?
Absolutely.
All right. Yeah. Vince Ford, thank you again so much for joining us on Coping with COVID. We're going to get Dr. Ellis back on. Tammy Epps is texting me now, trying to get Dr. Ellis back on. So we'll check back with him a little bit later on. As usual, I leave with a reading from Jesus Calling. Today it reads, "Do not search for security in the world that you inhabit. You tend to make mental checklists of things you need to do in order to gain control of your life. If only you could check everything off your list, you could relax and be at peace. But the more you work to accomplish that goal, the more things crop up on your list. The harder you try, the more frustrated you become. There's a better way to find security in this life. Instead of scrutinizing your checklist, focus your attention on my presence with you. This continual contact with me will keep you in my peace. Moreover, it will help you sort out what is important and what is not, and what needs to be done now and what doesn't need to be done. Fix your eyes not on what is seen, your circumstances, but on what is unseen, my presence. That's today's Jesus Calling. Basically, just let's focus on the Word of God and who He is. And like Vince and I said earlier today, I opened up the segment by saying it's out of my pay grade to understand what's going on. So I'm going to leave it up to the folks like Vince and Prisma Health and Jesus to take care of it.
Thanks to our medical staff. This is Nurses Week. So thank a nurse if you know a nurse. They are working around the clock, and our clinical staff. This has been a challenging time for our team members, and we applaud them for all the work that they're doing to help and keep this community safe.
Absolutely, because they are literally risking their health and their lives and their families' health and lives by being on the front lines dealing with this pandemic. So you're absolutely right. I mean, it's amazing. Tanya says, so glad to have additional testing sites in the marginalized areas in our Black and Brown communities. Absolutely. That's what Vince says, that they were really looking to find the areas that really needed the testing.
Absolutely. Well said.
Yeah. All right. Thank you so much again for joining us on Coping with COVID. Please go to my personal pages and like the page. You can go to my professional page, Tre Tailor or Tailor Made Production. Please like that page so that you can follow the updates and find out more about Coping with COVID. Tomorrow, we talk to Attorney Edie Lane about foreclosures. Many people are having some tough financial times and are facing probable foreclosure because they can't pay their mortgage. Edie is going to tell you what the updates are as far as that's concerned, what your rights and your responsibilities are. That's tomorrow on Coping with COVID. Then on Friday, we'll talk with Dr. Baron Davis with Richland School District 2. Vince mentioned that Baron was on a call about how to handle what's going on with our schools, celebrating our seniors and moving forward with the school year. Well, Baron's going to tell us what's going on with Richland School District 2. Next week, we'll talk to a couple of members of the COVID task force, including James Bennett and Rosalind Artist with Benedict College. And then on Monday, we're going to have a panel of multicultural hairstylists. They're mad, Vince. We're mad too because we can't get our hair.
A little bit, I understand.
You've got your COVID hat on.
Tell Edie Lane I said hello. She's a former board member of mine, great attorney, and she'll do a great job. Oh,
she really will. We're looking forward to that. But yeah, Monday, the hairstylists are open arms. They feel like they're an essential business, and they feel like, one, they're not being heard. They feel like they sanitize and they should be open. So we'll have that conversation on Monday on Coping with COVID. I'm Tre Tailor. Until the next time, please be careful. Please stay safe and remain blessed. Thank you again, Vince.
Thank you. Take care.
You too.